So, what is a regional trainer? Really great question. One I didn't know the answer to. It hasn't been done outside of America. It was the first time it was done, so spent a lot of time kind of scratching my head and talking with lots of people. The guys in Dartmouth, very, very helpful. Spoke with a lot of their regional trainers. And basically the answer is whatever your organisation needs. So each of the regional trainers in America would be doing very different things depending on kind of their locality and what was needed. So it was really important to kind of work with the guys in Sussex, South Downs and Sussex to work out exactly what that would be for Sussex Partnership. And for us, it was about doing fidelity reviews. We had 19 employment specialists at the time. Spent a very, very long time about scratching our head about how do you do the fidelity reviews. The guys in Dartmouth would go and do a team together. So did we do East Sussex, West Sussex and Brighton and Hove? Did we review each of the employment specialists individually? What would be the most relevant? And we ended up sort of going down the road of actually reviewing each team and each employment specialist individually, because we thought that would make the greatest impact. We knew that our employment specialists were very, very good at delivering IPS. They were IPS contract. What we were really struggling with in some places was getting referrals, getting the community mental health team on board, getting them to know their role and really getting them to kind of support the whole agenda that employment is everybody's business. So by going out and doing 19 different reviews, being told that someone from the Centre for Mental Health, and some who will have had that experience, is going to come and review your service, really helped in the minds of the managers and all of the people within that team. And I made sure, again, it was kind of finding my way a bit really. Who do you interview? Of course, the employment specialist. But we actually made sure that we interviewed key members of each of the mental health teams, so a psychologist, a psychiatrist, 3 or 4 different care coordinators. It was a very, very intensive day, support workers, and of course, most importantly, getting as many service users together as possible sort of over the lunchtime. So the kind of preparation for the fidelity reviews really helped the employment specialist have something in terms of, I'm in the mental health team, I really want to talk about what I do. Okay, this is a real good foot in the door for me to go and talk about IPS and why it's important, and actually what the mental health team's responsibility is in terms of supporting that agenda. Conducting them, very interesting, using kind of a questioning approach that draws out people's attitudes, making suggestions to them. Also, binge working in the community. Has there ever been a situation where, I don't know, you've seen an advert in a shop window and you thought, I'll take that back and show the employment specialist? Guarantee every time the answer is no, but most people will go, oh yeah, I could do that. Oh yeah, that's great. So using it as a learning opportunity at the time. And then assisting with the action plan. There is all this great research, and I think it's really hard sometimes to actually turn the research into what does it mean for this CPN, what does it mean for this psychiatrist in this team. So yeah, being part of creating that action plan. Demonstrating a learning culture. So talking about fidelity, why it's important. We did some specific training. Southdown did some specific training, I should say, for how to conduct a fidelity review that we actually held for employment specialists, but opened it out for the OTs as well. So trying to, again, pull in the clinical team. Introduce board level reporting. So part of the fidelity review is that you speak to the chief executive. I think a lot of people kind of forget that bit and don't necessarily have a conversation with the chief executive. But when you're talking about driving forward an agenda like this, the chief executive arguably could be one of the most important people that you talk to. And again, having the Centre for Mental Health logo when you're emailing the chief exec and asking for half an hour of their extremely busy time, I think really helped kind of get that foot in the door and talk with them. And that really sort of pushing it forward and getting the board level reporting on employment outcomes, making them a target for mental health teams, because whilst it's something great and lovely and nice to do and you can encourage people all the time, actually having a target you can report on is one of the strongest things that you can do to get your mental health team managers on board with it. Creating a bit of healthy, sort of healthy banter between them as well, telling them, by the way, the team down the road has got 14% employment rate and you've only got an 8, or with the fidelity reviews creating that sort of, you know, they scored slightly higher than you, this is the kind of thing that you need to do next year for getting yourself a bit better on that. People like a bit of healthy competition. Yeah. I know as an occupational therapist, when I have a new OT, I don't put them in a team and say, get on with it. I bring them into my team and say, right, okay, this is what we do, come and watch me, come and do some with me, let's then do some together, then I'll watch you do some. Why should it be any different with employment specialists? You employ them and then what, put them in a mental health team with no employment people around them, and then sort of set them loose on clients and expect them to fulfil all these different criteria. It's very much the American model that field mentoring would be used. In the teams that I was working in, they were very well established teams. The kind of room for improvement was around the employer engagement. I think employer engagement can be really, really tricky and sometimes it's at odds with the rest of the approach that we use, and it can be the one that employment specialists don't feel very comfortable doing. Very fortunate that just before I started Southdown, I'd done some training and really kind of pushed that forward. And actually going out with people. When I started, I didn't know how to do employee engagement either, but just going, come on, let's go learn together. And the more that you can kind of do it together and build people's confidence really helped. Dissemination of information and training as well, and becoming a purveyor, so you're the kind of person. None of this is rocket science, none of this is stuff that you quite possibly don't do yourself. But the idea about having a separate person, because you're doing it in your job with all your other stuff, but if you have a separate person that can do it, of course it can actually accelerate those implementation. And some of the key issues that people around the discussion table raised earlier, I know that if you're looking to change some of those, that it will be a lot of time in an existing job that you have that's really quite busy. So to have someone that's dedicated can really help. So, as I mentioned before, the links with Centre for Mental Health, really important, get the foot in the door. The guys at Dartmouth, extremely helpful. Many telephone conversations with them and telephone conferences, and work out different time frames and stuff. So actually communicating the evidence base and talking about that. Ran teaching sessions for staff who were harder to convince, perhaps less aware of the evidence. We knew in Sussex when we started that there were particular groups of staff that we really needed to target. And about 9 months, I think, to actually get my foot in the door with some of them. Our psychiatry colleagues in our trust have a whole afternoon on a Wednesday where they go and have teaching. So it seemed like a perfect place to kind of go and talk to them about IPS. But unfortunately, like most organisations, it takes a long time to find out who it is you need to talk to be able to pitch up at those and wave your flag. We held a specific event for our psychologists as well, supported by the centre. It could just help Connect to have those names coming along. I think if Jeff Shepherd wasn't there, we wouldn't have had as many people attend in any way, shape or form. I think it might have been Kate, actually. But having Jeff Shepherd there, he's going to come, he's going to talk to us, really got the crowds in. Being available for teams who are struggling to achieve outcomes, troubleshooting and offering tailored support. We knew in Sussex where the problem teams were. And the problem teams are probably the problem teams that have been problem teams for a long time in terms of lots of other things. And I'm talking about the mental health team here, not just employment. So we knew the ones that needed a bit of extra kind of support within them. And kind of going in and targeting those and being in there. And I think, you know, when you're aware that it's less of a recovery culture in a team and then you're putting an employment specialist in there on their own, it can be very lonely. So trying to go in and support that and help them out was great.
The big advantage, as Becky said, of having the trainer was having this dedicated time, a person who could think about all the issues that needed thinking about and actually do something about the issues. That was really critical. If you want to know the detail of it, it all sounds a bit odd, but it's in Briefing 44, which sounds like some secret ministerial. It's on the Centre for Mental Health website. Briefing 44 is all about Becky's role and how it kind of worked and what the outcomes were. What I should say is that we don't have that role now, because for various funding reasons, the funding, we never managed to find the funding internally to carry out the role. But what I would say is it did improve the overall performance, didn't it? And well, we've managed to keep it and improve it.
I was going to mention about the fidelity. The beauty of the fidelity is that Becky could do so many, is that we were very open and honest. I think there's a real pressure when somebody comes into audit or service, you put your best employment specialist, your best team forward as well. Becky was able to go in there and just see, report what was there really. And that was just a very honest baseline for us to actually work on. It's like, you know, we're open and honest, and we're going to develop it from there. That really helped us. And like Kate said, having Becky kind of networking through these other systems that I wouldn't have any idea of who was connected to what team, that just feels like a kind of, you know, a mystery to us from a third sector point of view. Knowing that there was that work constantly, every day there was something happening, really made a difference.